Okay, hello class. I'm Jessica Dreyer, and my presentation today is on hemochromatosis. This case study is actually on myself, so I am my patient. I'm a 31-year-old female. I go to my routine doctor appointments. Back in December of 2022, I had a high MCH level, which we're going to go into specifics of this later in my case study, but I was told that was nothing to be concerned about. My blood work on other panels was normal. And then I went to my PCP appointment this year in 2024, just like regular. And, I told my PCP about my diet. I eat a lot of red meat because of my fitness goals. I'm a standard normal weight of 5'5", 130 pounds. Same weight as last year, no changes there. And my blood pressure was a little low, 96/50. I do have complaints of brain fog and fatigue quite often, but I have regular periods and everything. But at this appointment, I had a dramatic change in my period, and I tracked my periods on my smartwatch, and I had been bleeding for about 42 days straight, not heavily, but spotting every day. So my provider had me do blood work, and this led to further follow-up appointments, and I have not been officially diagnosed with hemochromatosis, but the prognosis is led to believe that I do most likely have hemochromatosis. So what exactly is that? Well, hemochromatosis causes your body to absorb too much iron, which is stored in your liver, heart, and pancreas, and much of the body's iron is stored in the red blood cells. So I got most of my information from the Mayo Clinic, and the symptoms of this include the tiredness, brain fog, weight loss, joint pain, erectile dysfunction in men, and irregular periods in women. And there is a common type of hemochromatosis that is passed down genetically, but there are other types that can develop later in life, typically midlife. And in women, these symptoms typically don't show up until after age 60, when they start menopause and they stop losing blood during menstruation. So too much iron can lead to liver disease, heart problems, and diabetes. And now we are going to look at the symptoms. So what do you think my potential diagnosis of hemochromatosis, do you think it was genetically passed down, or do you think this developed later in my life due to a gene mutation, diet changes, etc.? Okay. Another question we're going to ask ourselves is, what symptoms do I have that are a direct sign of hemochromatosis? Yes, the brain fog, the fatigue, there was no weight loss, I do have irregular periods. And as a female, do you think it's more rare for us to develop hemochromatosis compared to males due to menstruation? All right, so we're going to go to the answers on these questions. So to the first one, do you think my potential diagnosis is genetically passed down or developed later in life? Well, I do not carry the gene for any type of hemochromatosis. Therefore, it is not genetically passed down. We're going to discuss this further in the case study because I did have genetic testing done. But I could have a secondary hemochromatosis due to higher iron or liver disease. And the direct symptoms, like we said, the brain fog, fatigue, irregular menstrual cycle, high iron saturation. And as a female, is it more rare for us to develop this versus males? Yes, it is, because we menstruate, and typically we would have anemia with less iron. So now we're going to go to the diagnosis of this and the procedures and data following. So I went to my PCP back in December of 22, like I mentioned, and we talked about high MCH levels. So now, when I go into my appointment this year, my iron serum is abnormal. I had my follow-up appointment with my PCP to go over the blood work results, and she advised to come back in 6 months, and that the high iron wasn't a concern. But I requested to have sooner blood work done because I continue to have this brain fog, this low energy, both concerns of hemochromatosis. And I actually did a little, Google doctoring myself, which isn't probably recommended, but I knew the concern and long-term effects of high iron on the body. So me being the hypochondriac that I am, I wanted to, double down on figuring out what was going on here. So I went back to my doctor. She said, if these next blood tests and the high iron if it's found high again, then she would refer me to hematology, which is blood doctors, as we all know. She said she'd write the referral to the Florida Cancer Society, which scared me a little bit, but I just thought it was interesting to share with you guys that a lot of times hematology and oncology are in the same departments and facilities. So a lot of time when people have just blood work, you will be referred to like an oncology center, but it's it's not a confirmed cancer diagnosis. So don't be scared like I was. So I just thought that was interesting. Now back to this MCH level. Okay, so what is that? That is the mean of corpuscular hemoglobin in our blood. So the normal range is 32.1 picograms on a scale of 24 to 30. So mine is a little high. Now this is refers to the average amount of hemoglobin in the red blood cells. So hemoglobin is a protein in the blood that allows cells to deliver oxygen to the cells and tissues in the body. Now, when levels are too high, that can be an indicator that red blood cells are larger and have a higher amount of hemoglobin than normal. And that condition in itself would be called macrocytic anemia. So if the blood cells are just larger with not a higher amount of hemoglobin, that would be called macrocytosis. So this type of thing is usually caused by like chronic alcoholism if this is not genetic. And I haven't had alcohol in 18 months. So now another concern here is the neutrophil level. So the neutrophil range is on a scale from 67.7 to 12 being the normal. I need to figure out what we're actually measuring here. That was my bad, but neutrophils are a type of white blood cell, and our body contains most of these, and they help fight infection. So it's called neutrophilia when the body creates too many of them. And neutrophilia is a reaction from the body to create more white blood cells to fight any rate of problem from stress to serious blood disorders. So some people are born with it. Others can get it secondarily for inflammation, even from vigorous exercise, smoking, arthritis, there's many factors. So again, these are the results from 2022. Now fast forward to this year. So these were the high iron levels. As you can see here, the high iron saturation is supposed to be between, a normal is 16 to 45. Mine was at 65%. That's very high. So when we went over these, everything else came back normal. The vitamin D, B12, TSH, T3, T4, lipid panel, the CNP, but the iron being out of range. This is what it looks like here. So next, this is the documentation of my cycle being 42 days straight. At my follow-up appointment, we went over this. My blood pressure was still low. I've been spotting at 6 weeks at this point. So the follow-up blood test, it turns out I did not have a CBC back when my iron was high, so we did that. And look here, we got the high MCH again, just like in 2022. So we had missed that when I would have high iron, a couple months before this. Now we missed that, and we noticed a change in the TSH level. Mine was normal in April. Fast forward 2 months, mine is now considered high. So we do have some inconsistencies in the blood work here, which is also a concern. So now, just for the purpose of the case study, I didn't have genetic testing done to see if I genetically have a form of hemochromatosis, but I actually, if people really wanted to figure out if they have the genetics, they can do genetic testing. So fortunately, and I thought this would be interesting to show if anyone's interested in genetics, I had my genes tested back in 2020. So I was actually interested in donating my eggs, and I had selected parents that, chose my eggs. They wanted to see if I was going to be a match with the sperm donor or the father, and, you have to make sure that, you don't have two people carrying certain genes where it would be, a confirmed gene passed down to the child. So, a lot of parents get this genetic testing done. So fortunately for me, I thought it was very interesting because I was able to get the results. And, I did actually find these in my records and found that I am negative for any type of hemochromatosis. But it was very interesting. Just putting aside this case study on a blood disorder, if anyone's interested in genetic testing, there's something called the SEMA4 genetic test. And so what it is, it's a test that orders, they test 283 genes. So in this case specifically, the gene associated with hemochromatosis is the HFE gene. And this gene encodes a protein involved in high iron metabolism, and mutations to this gene, particularly in the gene C28.2Y and the gene H63D. So those genes would be associated with hereditary hemochromatosis. Now, a condition where the body absorbs too much iron from the diet, type 1 of the genetic HFE gene is on chromosome 6. So the two common mutations on C28, sorry, my contacts are messed up, SY and the H63D gene, now we're going to look at hemochromatosis type 2, which would be the gene HFE2 and the hemochromatosis type 3 linked to gene TFR2. So that's a lot of information. We're going to go into explaining this. So I was found to be negative for both types of hemochromatosis listed. And I was actually listed as a reduced risk for both types. Now, what that means is they're both an inheritance of a type of autorecessive or an autosomal recessive gene. So if both parents were to carry a copy of this autosomal recessive gene, then the child would have that gene. So after analyzing the results, I was found to be negative for that gene, but I do have a minimal risk to pass it on because I do have the autosomal recessive gene. So now for anyone looking into genetics, this is what it looks like. Out of the 283 genes, I was found to be a carrier of 3 that may be a concern, but like I said, I do not have the gene. I am a carrier of the gene. So if I were to have a potential father of a potential offspring, if he carried one of these 3 genes, our child would have that. So that's why it's nice to get these genetic tests done to prevent any concerns in a child. And if anyone's interested, this is what it looks like. It'll tell you, the SEMA4 will tell you what you're positive for, some negatives, and then it'll go into the interpretation of those positive results. So those 3 genes that I was present as a carrier of, it tells you exactly what those are. So that's very interesting. And then now, this is like I don't even know, like a 14-page document of all these genes. So this is what it looks like. It's going to tell you the disease, the gene, the inheritance pattern, like if it's autosomal recessive, autosomal dominant, the status, if you're a carrier or a reduced risk. And then it'll tell you like a detailed summary of the gene there. So I just wanted to give a picture of what that test looks like. So like I said, here's all these genes. So fast forward, we got the hemochromatosis type 2 and the type 3, where it says that they're both autosomal recessive and I'm a reduced risk for both. So I just found that fascinating and very interesting. Now, some questions to ask ourselves. Thinking outside the box, for someone like me developing something like this random, and I'm a healthy individual, I was thinking about where is the source or the root of this problem of the high iron. So I was thinking, I was like, I moved in the past year to a historic district downtown Fort Myers. The piping is cast iron piping. And I previously read somewhere, with people with anemia, a lack of iron, that they're, recommended to cook in a cast iron skillet to get trace minerals of iron, incorporated into their diet. So I was like, is it possible that drinking, out of sink water, which I regularly did, has something to do with iron, just coming up within a year of my life? So that's one question that we're going to kind of resonate on. And 2, so since my saturation is considered high, can I alter my diet in any way to lower my levels? And then 3, I'm into fitness. Is it possible I'm taking supplements that are increasing my iron level? So these are all things that I was, just looking at myself. So the answer to the cast iron piping for the drinking water, yes, it is possible that cast iron piping for drinking water can influence iron levels. So the pipes release a trace amount of iron and they accumulate in the body over time. However, for most people, the amount is not significant enough to cause an issue. So, people who have iron deficient anemia are often recommended to cook with cast iron skillets. It may or may not be enough in either situation, make a significant change. So, now that my level's already high, what can I do? Can I alter my diet? Changing diet alone is not sufficient enough to change someone's high iron level when it's that high, which I found very interesting. And since I'm into fitness, is it possible to take supplements increasing the iron? Yes, it is possible, but I looked at my supplements. I'm not taking anything with iron. Even if I was, most of the time, taking iron supplements are not enough to cause an issue like this. But if, let's say I was taking iron supplements and I had this issue, it definitely will exacerbate the issue. So, not recommended with high iron to take supplements with iron. Case in point. So, now, how does hemochromatosis affect the body? Let's look at the physiology. So, this could be an explanation for the high MCH and the high neutrophil, because high iron leads to various changes, including effects on the neutrophil and effects on the MCH. So, what happens is too much iron stimulates production of white blood cells in the bone marrow, and this can occur in people with hemochromatosis because the body's responding to iron overload, which is inflammation and other symptoms, associated with hemochromatosis. So, when the high MCH reflects the average amount of hemoglobin present in each white blood cell, the conditions like hemochromatosis can be changes in the red blood cells. So while the high MCH is more likely associated with certain types of anemia, like macrocytic anemia or vitamin deficiencies, in the context of iron overload, this could theoretically be seen as changes in the white blood cells or the hemoglobin content due to the metabolism of the iron being altered. So it is important to note that iron overload usually presents with a different set of hematologic abnormalities, which are increased serum ferritin levels, elevated transferrin saturation, and potentially decreased red blood cells. So when we see the elevated saturation on my panel, that was a raise for concern. Now, how does hemochromatosis affect homeostasis? Homeostasis is our body's normal rated state to function, right? So it affects a lot. It affects our cardiovascular. So excess iron can disrupt the heart's ability to maintain blood pressure and heart rate. Significant changes there. The endocrine dysfunction, our hormones. Excess iron affects the pituitary gland and the pancreas, which causes hormone disruption and regulation. Due to it having an effect on the pancreas, that can raise insulin levels and cause potential diabetes, So it also affects joint and bone issues, which I didn't listen to the study. I have a lot of joint and back and issues that is it the chicken or the egg? High iron, working out too much. I don't know. I'm not a doctor, but it can cause possible arthritic-like symptoms. Now, liver disease also is the big concern here. So excess iron impairs the liver's ability to function and perform metabolic function. So that's, like I said, the high iron is stored in the liver. So that's a major concern there. And then with the iron overload, there's oxidative stress. So the accumulation of high iron in the tissues of the liver, heart, and pancreas, and the joints, the excess iron produces the free radicals where the iron reacts and generates the reactive oxygen. So the homeostasis is definitely thrown off, and when you're in a state of constant inflammation, the white blood cells, like we're seeing, go out of control. It causes a lot of secondary symptoms. So, questions to ask ourselves: how does hemochromatosis affect iron metabolism in the body? What are the potential long-term consequences of not treating this? And are there preventative measures we can take to avoid developing something like this if it's not genetic? So the answer key: how does it affect the metabolism of the body? Well, as we just discussed, the excess iron is deposited into various organs and tissues, and it can damage them over time. The consequences of that, of being untreated, these can have effects on not only the organs now, but the organ systems. So if you leave it untreated, for example, there could be progressive organ damage, which increases the risk of serious condition. You don't just have higher iron in the liver, it could lead to the liver cirrhosis. The heart disease, heart failure, like I said, the pancreas hormones being disrupted, that can lead to diabetes. So ultimately, overall, reduced life expectancy if not managed effectively. So what can we do about it? What is the prevention for this condition? Well, there are some proactive steps that we can reduce the likelihood of developing complications associated with it, but not necessarily full prevention. So early detection and intervention are what's key here. So like we learned here that the regular blood testing, going to your PCP, getting your regular blood panels are necessary to catch things like this. So, someone like me who has normal levels 1 year, go back the next year, they're off, earlier intervention is good, and regular monitoring to make sure that this doesn't exacerbate, get out of control, and then we have, not only symptoms, we have system disruption. So the early detection and intervention, like I said, is key. We learned that regular blood testing, blood monitoring, and genetic testing they're all tools we can use as preventative measures to detect the high iron. And then we can make a decision on our lifestyle, our diet, or medications that we need to use and utilize. So the treatment for this. So the main goal of treatment, obviously, is to prevent the progression of iron overload and assist associated organ damage, and improve symptoms and enhance the quality of life, just like any treatment, So a treatment for this, like I said previously, once the iron is high, can we remove that from the system at this high of a saturation? No. So phlebotomy, drawing of blood, that is on the severity of the case. So they may have to have blood drawn. So it's very a similar process as donating blood, where you do a pint at a time, but it's on a routine basis. And typically, depending again on the severity of the case, 1 pint is donated at a time. It could be a couple times a week, but again, the iron, to remove the iron is how often depends on each individual. And then, correct me if I'm wrong, chelation also is a medication used. It's not common, but it's a resource that if someone has anemia or other complications, that the medication is either in a pill form or an injection. And what the drug does is it binds to the iron, and then it can be secreted properly in the urine or feces. So it's important to note that this is not common or the first line of treatment per se. So now for the final synthesis question over the entire case: how does early diagnosis affect the prognosis of individuals with hemochromatosis? So the answer to that is early diagnosis significantly impacts the prognosis and outcomes for affected individuals in several important ways. Like we said, prevention of organ damage, improved quality of life, long-term health maintenance, and preventing other complications. So improved quality of life is always number one. Now here are all my references. I got my slide format from Slides Carnival if anyone's interested for further presentations. And how I would like to close is, a lot of times when we hear medical presentations, we hear stories like this, but we always want to remember the story, find a follow-up. So how am I doing today? Well, as you can see, this is recent. For the purpose of this case study and for this class, I have upped my follow-up appointments just for personal knowledge and research and to inform my classmates. I'm doing well, and one thing I'd like to take away is, everybody's different. There's no rhyme or reason to why things happen sometimes, but I personally believe that with someone having regular periods like I did my whole life, and then I developed this high iron, all of a sudden I have a 6-week period of spotting and stuff. The body is a miraculous thing. The body does recover. I am a healthy individual, and I believe that is why when I went for my follow-up appointment on the iron, I now have normal iron. It is below 45%, so it went down 20% in less than 2 months without phlebotomy, without medication, without changing my diet, because I knew that wasn't a thing. Our bodies, I firmly believe that due to the hormone disruption and things like that with the irregular periods, that my body is secreted through menstruation to get rid of the blood, and you know, that's essentially the body cleansing itself. So I do think that it is always important to note that if we take care of our bodies, we eat healthy, we exercise, we drink water, that we can be our own medicine. It doesn't necessarily need medical intervention, but I truly believe that we can prevent and treat a lot of these secondary symptoms by treating ourselves properly. And you know, I'm always awkward on my last note, so I'm going to leave it with that. Thank you.